that we've done in Oklahoma. I hope you find some takeaways that will inform your approaches elsewhere. My name's Sam Carnes. I'm a rural and telehealth specialist for Oklahoma Complete Health, which we're a state Medicaid managed care organization and a subsidiary of Centene. So prior to working in healthcare, I also worked at the Oklahoma Broadband office, contributed to their digital equity plan and 5-year action plan, and also at the Oklahoma Department of Libraries, where I had the opportunity to roll out 5 telehealth access points in rural and underserved areas. I was a library development consultant at that time, and so we were able to use ARPA funding to roll these out. But a lot of this will be applicable to other types of funding, and that's something we'll talk about. It's just it takes a little bit of tweaking what you'll have to do, and just some of the considerations that you'll have. Um, so in my current position at Oklahoma Complete Health, I assist really all things rural and telehealth, including administration and implementation of large-scale telehealth projects, outreach to rural areas, partnership with rural and telehealth providers. We currently serve about 200,000 members and also administer the state's only children's specialty plan. Really, and you see here, we pride ourselves on our local involvement. We really believe that um, good healthcare in rural areas requires maintaining a heavy presence, and also just getting involved, getting out. A lot of the unique solutions are going to come from those members just through conversation. Um, and so, yeah, I really encourage you to get out to your communities as much as possible. Um, and I would be remiss if I didn't mention that we also likely have an equivalent health plan in your own state who would love to partner on rural health initiatives like this. They'll have a staff member like me who's devoted to rural areas. And they would love to just even be on the conversation. And for Ohio, that's going to be Buckeye. I'll have to look up our Indiana plan, but happy to provide any points of contact if you need that. If you're looking to set up partnerships or anything like that, just feel free to reach out. So what we're going to be talking today are telehealth access points. Private, clean spaces, often with a digital navigator who can help members with set up those appointments, work through any uh, issues with devices or just setting up the appointments. But I really we prefer them to be ADA compliant. They're places that are going to provide connectivity, so really solid connectivity. A lot of times they're going to be put in community anchor institutions like libraries, FQHCs, schools, places like that. There's a big emphasis on privacy, and then some remote diagnostic equipment. And again, this is a scalable model. It's not. I'll be talking about libraries because it's really the places where we rolled them out to, but this will be something that would work in a lot of different environments. And really, we have since expanded in Oklahoma. We are looking at those other locations. We have school presence, FQHC presence. Um, it's all just a little bit different. Some of the concerns, and some of the areas that you'll have to focus on to, create buy-in there. Um, And so really I want to start first with just a quick overview of barriers to rural care. Um, and so while our states may differ in makeup and administration, the issues are often going to look the same. One of the ways I like to visualize it is with just a simple Venn diagram like this, where you see most of the rural areas, they have no physical options, so not enough providers. If there are providers, that there may be long wait times. There's also going to be very little transportation. Some states are better than others for sure, but the transportation problem persists, especially in the rural areas. And then there's also a lack of connectivity, which really all together they tie in, make for inaccessibility and isolation. And they also kind of, especially in no connectivity, limits just how much telehealth can fill these gaps. And then kind of surrounding all of these is going to be that local knowledge. It comprises all the truly creative ways in which communities come together to overcome those barriers. And it's going to inform how you roll out in a particular community. Who will be your partners, who you'll need to reach out with, create buy-in. Um, but that local knowledge is really important. And that's something that we can also look at too is, at least in Oklahoma, rolling out into a rural area, maybe the difference of working with a state or a tribal partner, or just the individual municipality. Um, so yeah, it's important to think about that local knowledge when analyzing these. You know, uh, I did just some research for Ohio looking into these. There's a few different types of bus routes, kind of run from, the scheduled bus stop that everyone thinks about to demand services, which can pick you up from a set location and drop you off along the way. Um, and really, from what I could find, Ohio's transportation situation is much better than Oklahoma, but as you can see from the continued barriers, there's um, still some problems, some areas for improvement. And so 11% of rural residents report having access to public transportation versus 83% of urban residents. Um, it, the average drive time also being 31.5 minutes. It's about the same for any rural community in the country. And again, that really changes based on provider availability. So, for example, in Southeast Oklahoma, we just had a maternity ward close, one of the only ones there. So now for anything maternity related, you know, our members are going to have to drive hour to 2 hours to the closest location, which if it's an emergency, that's going to mean a meta flight, which is extremely expensive for all parties involved. Or it's going to be, them maybe driving out of state, which is not ideal, just administration wise. Can also be expensive, can be expensive for the members. Um, and then when it comes to after hours, it gets worse. Sometimes some facilities are reporting up to 4 hours that they're having to wait for members to be picked up. So, transportation it really affects outcomes. And that short being able to get someone uh, to that first point of contact with the provider is hugely important. And telehealth is one way that we can step in and get that. There's a lot of members who think they're an emergency, rush to ER, may not necessarily need it. And if they're able to be evaluated on the way or beforehand, that could save for everyone. It could save them time, save them money, um, and just result in better outcomes in general. Um, when it comes to health inequity, there's another thing. I thought it was really interesting how much the two states were very similar. You have your large city centers kind of cutting diagonally across the state. Um, Health outcomes generally going to be worse the farther away you get from those city centers. And these health inequity maps also one thing that's important to remember is um, life expectancy is tied into it, child opportunity, area deprivation index. And in some cases, the darker areas can represent shorter lifespans of 10 years or more, which is huge if you're thinking about, and especially if you're looking at a state like in Oklahoma where average lifespan's already short, cutting another 10 years off of that's significant. Um, and what can be inferred from these challenges? Again, fewer providers, longer drives, poor connectivity, poorer facilities. All of this kind of limits availability, increases isolation. Looking at it from the broadband perspective, it's very similar to the health inequity maps, if not more apparent, that the city centers are served. and everywhere else outside of it, it has pretty poor connectivity, poor availability. Um, and again, this limits the viability of telehealth in general. So some of our broader telehealth solutions, like if hospital at home, really getting devices into the household, um, anything that's not going to be at a community anchor institution, which will have good connectivity, um, it's going to affect the rollouts there. But luckily, with the work from the broadband offices around the country, this is starting to improve. But again, there's still huge gaps. If anything, it's an opportunity, I think, for uh, health plans members, the state, people to reach out to your broadband offices and figure out where those rollouts are going, so that you can plan accordingly. And then also they are likely going to have digital equity initiatives, so digital literacy trainings, things like that, that would significantly help the members in these areas, patients in these areas. And so having, if you can align those with some of your rollouts, that can help, especially when it comes to providers who raise that concern pretty often. Um, and again, this is something we went over last time. The digital infrastructure score is available. Please go in. If you're looking at particular counties to roll out, you can go into this map and see exactly where the availability is. Um, you can see the speeds, everything you would need to be able to evaluate a certain location. So yeah, please check that out if you haven't already. And again, I just kind of went through based on those challenges and pulled some counties. These are the ones that consistently rank in the bottom quartile of Ohio County health rankings. Um, it's going to be in factors like primary care. So it's like a ratios exceeding 4,000 to 1. Um, they're all highly rural areas, classified as rural areas. Um, they have elevated poverty, zero vehicle households, unmet needs in mental health, chronic disease, and preventative care. Um, and interestingly, is from Ohio, these are also going to be, I think, several distinct regions that you could roll out and test scalability. And really just wanted to pull these out to kind of look at them and have some examples that we could look at. But in the Southeast region, we have Appalachians, tons, very highly isolated, poor health outcomes. Uh, West, Northwest, kind of Southwest, you have the farmland areas. Um, Rolling out's going to be a lot different because the rurality looks a lot different, but they still face those same issues. And so just trying to overcome those, it's going to be working closely in those particular counties. Um, and overcoming these barriers takes multiple overlapping solutions. Um, but again, telehealth access points kind of target all three of them. And I think are a good way to reach like the very isolated areas. Um, so choosing sites, when it comes down to choosing sites, I kind of broke it down into these 5 questions. These are the ones that we really considered. Um, so first, what's your fund requirements? So for us in Oklahoma, that was, we were using ARPA funding. So we couldn't have any permanent fixtures. One of the things it was kind of uh, not really an option was ADA access. We really wanted it to have ADA access. And so that told us what type of telehealth access points we needed in terms of space and construction. Some of the concerns for you, since this is rural health transformation, there's probably going to be like the CFR, the purchasing considerations that you'll have to look into. If your state has any restrictions on rurality or alternate definitions, that's something that's going to limit your available locations. Um, And there, if you were considering anything about reimbursement, there's a limit on how much can be spent on reimbursement that way. Um, so going directly to the providers, that's something that you would have to iron out some more, and it may limit the locations that you have. Um, Second, where's the need? And I feel like that's something we just went through with those maps, kind of determining need. For us, again, it was poverty persistence was huge. Um, and so based on that definition, that kind of limited our locations again. Um, so third, who are your partners and what are the recommendations? This may be the most important one in my mind, because recommendations for us hugely shaped our selection because, we went with a big list of available sites that we could go to, and the partners were able, because of their past experience in working with these, and the Department of Libraries, since we had decided on libraries as being partners, the Department of Libraries had intimate knowledge of each location. They could tell you who made good partners in the past on previous projects, who they thought they knew each of the directors, were able to talk about which directors they thought could handle this. Um, Really, their insight into this, I think, was invaluable when it came to the selection process. So, sometimes the partners are obvious. I think with ODL it was, but sometimes not. And it's important to take the time to select and collaborate, and then ensure proper buy-in from them as well. Um, our other partner at the time was uh, Oklahoma State University. So they're a big research institution. They were able to provide some data collection help for us. They'd also done some projects with these libraries in the past, and were able to vouch for certain ones. So, just again, rely on your partners if possible. They have some great information that will help with the success of this. Um, and then when it comes to the limitations in the project design, again, we were looking at ADA compliant, but one of the things, so we wanted to make sure was that there was a wheelchair could fit into these locations, and that they also still had room for a caregiver. So just based on that limitation, some libraries were not able to facilitate that just because they didn't have the size. Um, and then again, some locations were not necessarily ADA compliant, and so it was either going to be, do we eliminate this location? Do we try to go to the city and get sidewalk fixes, get an elevator put in, all these things that you have to be compliant in that case. But again, when you're looking at RHTP, again, are you looking at, do you have a certain set of equipment in mind? So if you're doing a booth, for example, um, that's a movable solution, but it may be bulkier than just retrofitting a certain room. It's also going to be more expensive. So you'll be able to, you would have fewer sites that you could work with if you're doing it that way. But again, just try to think of that, the limitations in that product design early. That's really going to help you choose your sites. And then lastly, do you have site buy-in? That's a huge factor in the success of these. And that's something that comes and goes. I think it's really important when you're working with these that you're trying to meet all their concerns, but you're meeting with them personally as much as possible. And then even after the project has kicked off, to have regular meetings with those partners, just so that you can ensure that the buy-in is still there and that you can address any concerns, those kinds of things. But um, and in some cases too, it may require going to the towns, the actual municipalities, and meeting with their administration to try to work through the problems that they may have with it. Um, for us in Oklahoma, this is what it kind of ended up looking for us. We had their administrative partners, which I talked about, and then our community partners like our libraries or media centers. Um, and again, I don't have it here, but these community partners, it didn't just end here. Each of these community partners also partnered with other members of their communities. They had a lot of back and forth with providers, with their actual municipalities, economic development authorities, all of those. It kind of cascades. They're going to need partners to make these a success, and so uh, some of your administration is going to be working with these to set up business plans, presentations, making sure that they're fully equipped to actually liaise with their cities. So when working with those municipalities, and these are some of the concerns that were raised for us rolling out, and you see it pretty often. You'll get these questions a lot. Um, Privacy being a very common one, especially in rural areas, because everyone's business is everyone's business. It just, if you've lived in a small town, you know that you know everyone and their neighbors and their cousins and uncles and everything about them. Um, and so privacy, just beyond HIPAA, is going to be a big concern for those communities. They want to make sure that they're taken care of. And they're not going to want to go to, you know, sensitive appointments like mental health or anything like that if they think that there's someone who's going to be prying. Um, so for that reason, all of our booths came with soundproofing built into them, but you can also retrofit spaces with sound dampening foam. We've done that pretty often. It's quite a bit cheaper that way too than going with an actual booth. We've also, one thing people helps set people's mind at ease. We include wipe machines with every location they can turn on when they're going in. Just further helps muffle speech. I don't know that it's necessary, but again, it calms their fears, which I think is important. Um, and then again, all computers were set up with SIPA compliant firewalls, and then software that wipes data between uses. That's just, again, making sure that people are taken care of. Um, Another concern that people had is sanitization, especially in these private small areas. Um, so HIPAA filters we included in everyone. They passively clean the air. That's an easy lift for sure. UVC lighting as another one that's we've included with each one. It disinfects surfaces between uses. Um, in our case, the booth kind of runs on a remote control. So when someone leaves, they just hit the button and it does a cleaning cycle, runs the HEPA filters, runs the UVC lighting to clean surfaces. Um, and if there is any concern further, if you need if you need to do a deeper clean, one thing that we included with all of these was going to be an electrostatic sprayer. Um, it ionizes the solution, makes it clean the surfaces better. It can clean surfaces. So for like this example, it can clean a wheelchair in 20 seconds versus 84 seconds. So you can really go in and just kind of spray the room, and really feel like a Ghostbuster while doing it. It's super fun. Um, I definitely encourage to keep these as much as possible. Um, and sorry, just to go back, this is another thing that helps the locations, just because they're already cleaning surfaces and everything. So anything we can do to try to make it an easier lift for the actual uh, partner site is going to be very helpful and is going to help them with workflow. Um, so again, try to think of it as keep making it as simple as possible, without sacrificing on cleanliness. Um, Also going to be getting questions about room booking. We this is one reason we chose libraries, was that they had experience already in booking rooms. In rural areas, at least in Oklahoma, there are very few bookable private spaces. Um, and so there wasn't much, there weren't many people who had experience with it or something set up already. Um, just want to say that there's a lot of existing policies and procedures out there. If you need anything like these, feel free to reach out and we can find one that fits for you. Um, or we can always edit one just to make it fit. Um, the biggest concern I think always is just making sure that people aren't double booking and how that works in advance. But um, yeah, we can work through that. Happy to help. Feel free to reach out. And then the last considerate or the concern I would say is equipment. These communities wanting to make sure that they're getting something nice and that works. And providers want to make sure that the space they're going to be in is actually well lit, and it's not going to be a waste of time for them. So they want there to be quality equipment, strong enough connection. Um, so again, high quality video camera, high quality microphone, multiple computer screens just helps with workflow. Um, Strong internet connection, that's something it should be in the your site selection essentially. Any of the community anchor institutions or most of them should have up to a certain extent quality internet. Um, Libraries, a lot of it's going to be funded through E-rate, so they should have some decent connections that way. Um, but yeah, the digital infrastructure score will help with that. Adequate lighting is huge. You can have the best cameras and it'll still look terrible if your lighting's bad. So you really want to think about lighting in it. And then basic diagnostic equipment again, so that uh, if there is a certain concern by the provider that they're able to check blood pressure, um, the pulse ox, thermometer, all of those basic ones that they might need. I'll say here we also included care kits with some of ours. So, it's a handheld diagnostic device. This is something they've partnered with our schools in the past, and so it just provided a good opportunity for if a school wanted to partner with these, they could come in and use these. Um, yeah, it just provided some extra utility in that sense. Um, so looking at how some of these examples, how this manifested were so the Benson Media Center, this one was not actually a library. This was a kind of in partnership with the library. They wanted to get a media center that could be used for job interviews, trainings, those kinds of things. So we had been kind of having back and forth with the city. The city ended up refurbishing or remodeling this existing church. Um, but one of the things they added because we were doing this project was an elevator, which was nice. So we were ADA compliant in that sense. Um, they had a digital navigator, um, which you can see here, helping a patient. His name was Cliff. We actually ended up hiring him at Oklahoma Complete Health. So there was, I feel like it provided opportunity. We it improved this project improved the spaces in the church. We were able to go in, we added this in the basement again, so we got the elevator added in. Um, we partnered with a lot of local providers, the state health departments, held a health fair for grand opening. And this one kind of presents an interesting case study too, I think, because what really took off, this was at the beginning of medical marijuana being introduced in Oklahoma. Um, and that was a large number of the visits to this space at the time because there were not those were almost all done via telehealth to get their license. And there weren't any of those providers within driving distance at all. And so a lot of these places were just, once they found out this was available, they were funneling people to this location to get it set up. Um, yeah, there's a lot of different ways that these can be used. And again, I like to bring up too, even if it's just used as a private space, like that's hugely important. Um, there's not many private spaces in rural areas, and so I'm happy if someone goes in and uses it for a job interview. Like that's awesome. That contributes to healthcare. Um, Getting them a job is important. Um, so yeah, I just again just like to point out the different ways that these can be used. Um, Another example, so the Hinton Public Library. Um, this one was very interesting because of all of the work we did kind of leading up to it. Was this library at first was in a very tiny location. It could not fit any of their existing equipment. We really wanted to get this put in because really where they were located in Oklahoma, but they just didn't have the space. And so what we ended up doing, we worked with the librarian there. We created a kind of a business case that we took to the city, and then also the Economic Development Authority, where we asked for a larger building so that we could implement this. Um, and the Economic Development Authority actually had this building available. They gifted it to us. They gave us another $200,000 to outfit everything. Um, and yeah, so this one was just there was a lot that went into it to build that framework. And that's something that I think that a lot of communities should think about too, is how, once this is implemented, this is something that you can leverage for further partnerships, for better facilities, those kinds of things that, you know, it's just something that you'll have to fight for. And so you may have to support those communities and those local partners and when you're setting these up. Um, Again, and this one had a private entrance for telehealth users. It was fully ADA compliant. One of the benefits too was located on the same grounds as the public schools. Um, and like I said, we added a title kit, so it was very easy for them to partner for a school program there as well that utilized these. Um, and then the last example, so the Southern Oklahoma Library System. Um, this was one we introduced a booth right at the beginning, and you can see that there on the right. They actually ended up expanding from that initial booth to two other locations. Um, and you can see on the top left, I think that's a good example of how these can look different too. So the top left picture there is the one of the ones they added in, and they just retrofitted a existing room to make it into a telehealth room. That's if that's possible, that's the easiest and cheapest way. Um, Another one that you can see though that they did below it, they actually had an empty space that wasn't walled in yet, and so they had worked in partnership with AARP to get some funding to wall that in. Um, and so and they don't see it here, but there are blinds that close to make this more private. Um, but yeah, it just allowed for some extra space for them, and more options that they could work with in that sense. Um, you know, so the first location, the one where we added the booth, is actually it was in Atoka. This was one that was hit by a tornado this last about a year ago now. Um, and it was, it wiped out the town right up next to the library. So one street over from the library was wiped out. The library got a little damage, but was still standing. But because of these resources that we had we were able to let the Red Cross, FEMA, SBA, utilize these spaces for disaster response, which was great. We were also able to help bring in additional Wi-Fi options so that we could provide Wi-Fi for them. Um, yeah, it really opened up this location to be able to partner further, which is something that we wanted. And trying to think. So, and one of the other things they're able to do here, they had again, you can see here the exercise equipment they've included. Um, and this is some of these are actually they can check out as well. Some are used in the library, some you can check out. They hold vaccine clinics at this location now. They have health literacy programs. They actually have a uh, professor of a program who comes and holds his classes in here. There again, just a lot of uses. It kind of opened them up to be able to partner further. And so, yeah, and I feel like going forward, I would be doing a disservice if I didn't talk a bit about the challenges that we face with the rollouts. It wasn't all sunshine and rainbows. Um, so when it comes to libraries, it's important to remember that the small municipal libraries are often thinly staffed. Um, so while we wanted to choose these locations because they already kind of did that similar work, we thought it may work into their workflow. Not all of them were able to accommodate that. We had to work in mechanisms for them to hire digital navigators at the same time, to kind of support the staff and claim ownership of the booth's functions. Um, you know, what ties into that? Federal funding through IMLS is in a state of flux. That could create some hesitancy and maybe reinforce that you will need a funding mechanism to help hire those digital navigators. Um, Measuring impact with so many people, it was a challenge, and I was really thankful that we had Oklahoma State University. Um, they were able to provide one of their data managers or survey specialists who helped build surveys, and get those put out into each of these locations and kind of oversaw that. So again, I really recommend that you have a partner who can do that. If you're not going to claim ownership, if you're just think about how much time it takes to roll those out, and to keep on the sites to keep collecting. So you'll have to dedicate some sort of staffing to that. Um, oh, and lastly about libraries too. So some of these small municipal locations, and again, this is going to work. This applies to any small municipal community site. Um, because they don't have administrative oversight the same way that a large system library would or a large hospital, turnover is going to affect it pretty heavily. Um, you're going to lose a lot of organizational knowledge. And so you have to think about how you're going to preserve the project, how you're going to keep it running. Once that turnover happens, who's going to retrain them? Who's going to establish that buy-in again? Um, just something to think about that some of the administrative oversight would be very helpful, I think, in these instances. It was easier getting these set up and keeping them running uh, through our system libraries than it was through our municipals. Um, so school challenges, to me, school telehealth kind of seems like a no-brainer when you're looking at the challenges that we were before, challenges to rural care. Um, the kids are already there. They have spaces available. They're already in rural areas. They likely have connectivity, but they kind of face the same problems that libraries do. Funding is often not guaranteed, the smaller they get. They may not have the staffing available again to be able to take this on. And so, that's going to overwhelm them. You'll have to build in mechanisms to help fund them. Um, there's very few actual, and Ohio is really better than Oklahoma. Oklahoma, we have about 400 nurses covering 1,900 schools. Ohio has 1,800 covering 3,000, but you still see there's large gaps there that have no nurses. And those sites it's going to be a lot more of a challenge trying to roll them out there. Um, there's also limits. So if you were going to instead not have a nurse and you had a volunteer who came in and did this, there's limits to the services a telepresenter can provide. So you're kind of narrowing that funnel. So yeah, just something to think about there. Ideally, there are clear funding mechanisms, reimbursement mechanisms that would help pay for them. It's always the fight trying to get originating site payments to include school nurses. But something like that, if it were more robust, would make it uh easier. There would be a better business case for hiring more nurses in those locations, and telehealth would be able to support their being there. Um, and provider challenges, rolling out for existing providers. Again, it's important to be cognizant of the business case and the concerns that would come about. Um, so shifting reimbursements, that causes confusion. Um, so they only see a clear path to profitability, and they also want to make sure that this isn't threatening to them. It's not going to inhibit their workflow. It's also, you know, uh, are they keeping all of these patients? Are they, yeah, they just want to see again that this is something that's not eating into their business. So just something to think about. Um, when rolling out to FQHCs, I would expect questions about reimbursements and coding. I'd have clear-cut billing guides ready to distribute. That's something that we're working on a telehealth project in Oklahoma, and that's really the first concern was, hey, how are we going to bill for this? Um, because it's not always clear cut, and with the different modes of telehealth available aren't always reimbursed the same way. So again, having a clear-cut billing guideline would really help calm their fears. Um, another concern is the telehealth waiver. So we got that extension for 2 years, which is fantastic. But they're still temporary in nature, and that can contribute to hesitancy to partner on long-term initiatives. Um, so again, that is just something that you'll have to think about and work through with them. Um, and again, finally, there's the digital literacy as another major concern. Um, again, that's something that is improving through the works of the broadband offices, but at least here in Oklahoma, we just recently did surveys, and a significant number of providers had concerns about digital literacy for their patients. And so that's where the digital navigators come into the equation. They should be able to help, you know, fill in with those problems, help patients, work through any of those problems that they may have with the actual visit. Um, and then another thing that, you know, could be done, I think, just working through the state is trying to help bolster any additional digital literacy initiatives. So finding out which ones are rolling out through the broadband office, trying to supplement those as much as possible. That just kind of takes some of the weight off of the provider's shoulders. Um, and then again, just mentioning workflow interruptions, just making sure that this fits into their workflow. Again, they may not be funded well enough to be able to support one as well. I mean, they very likely will, and they're positioned to be able to do so probably better than libraries and schools. But again, it might be another thing where you'll have to build in some sort of mechanism for reimbursement so that they can uh, make the business case for it. Um, and I don't want it to make it seem like I'm pitching library telehealth booths as like the one-stop shop. It's not going to fix all of the problems. It's just a very targeted way to fix, to meet some of those uh needs in those particular areas. Some other solutions, that we try to weave into these, again, phone hotspot programs, support connectivity, telehealth at EMS sites, any home health related hospital at home programs, um, anything that's going to try to meet these, because I think it takes a lot of different solutions weaved together to be able to meet patients where they are. And it ends up looking like this, going back to the original Venn diagram. Um, you can see that the telehealth access points there in the middle because it targets all three, but being able to rely on those other solutions does help. Um, and yeah, and there are going to be some existing programs in place that you'll be able to weave into it that will help support these programs. Um, and so creating a list of those ahead of time is going to be very useful. Um, and it's going to help your actual partner sites being able to administer these programs. If they notice a particular need, having those resources available that they can distribute is huge. And that's something that digital navigators, that's what they were created to be able to do. It's just making sure that they're equipped and, um, have that reflex to check back to those resources. Um, and so, yeah, just to finish it off, if you need any training materials, any more guides, anything more in depth, those exist. I've got some here. Um, Again, if you have any further questions, feel free to reach out. If you just want to talk through a program or talk through some site selection, that's something I'm happy to do. Please feel free. Um, but yeah, again, I love this work, and I think that it does make a difference in these areas. I lived in rural communities for a long time, and uh, just having some access is huge. If I were living in those rural areas again, I would definitely rely on this because the library was the place I basically lived at. Um, and so yeah, again, thanks for the work you're doing. Again, let me know if you have any questions.
Thank you so much, Samuel. I learned a ton about telehealth access points today, and I would like to open it up to our attendees. If there are any questions for Samuel, please feel free to use the chat function. We've got a couple questions. Whoa, okay, the chat is going off. First question, would you say discussing with potential partners the opportunity for a TAP to be included in a disaster response plan would be a good way to, sell it, or, what's in it for me on the idea of, the importance of implementing this in a community?
I mean, I definitely think so, especially again with that site that we rolled out. That was not necessarily what we were expecting for it to be used for, but it was very useful at that point. And I think it's just thinking about the partnerships that can come from it opens up a lot. Um, but yeah, again, I think that's a great way to sell it.
Fantastic. Thank you. And Carrie asks, I am working on the Rural Health Transformation Workforce grant in Ohio, and this is part of the proposal that we will be putting out to subaward. I would love to stay in touch. Samuel, would you mind
Yeah,
dropping your name and email in the chat? You will get a copy of the slides and his contact information, but just in case Carrie wants to put together an intro email now, we'll go ahead and have him drop that in the chat. Jamie asks, good
absolutely.
afternoon. We have a telehealth program at the schools, and the volume does not support the pay for the nurse or the telehealth presenter. How do you keep a program like this sustainable?
Yeah, and that kind of goes back to the challenges I had. Reimbursement is always an issue. In Oklahoma, we're trying to push for, and actually they just passed it, is an originating site fee that includes school nurses. And so, that's one way that can help, trying to, gosh, it is hard. I think trying to weave in other types of grant funding is something that we've seen. Oklahoma State University, they have their own program and they run it through a couple different grant options, but the equipment is provided through one and then services through another, but they actually have staff members who oversee it. Um, and that's something that I'm happy if you would like. I can try to get more information for that for you. We could set up a meeting with Oklahoma State University and see how how they keep theirs running. But that is a common problem. You know, I can think of another university that has the same issue and they've had to withdraw it. You know, I think really what needs to happen is that funding reimbursements that make these programs sustainable through like healthcare programs need to be the same as in schools, or schools need to be the same as those, you know. Having wildly different funding mechanisms makes it impossible to keep things running.
Absolutely. Thank you. And if he's offering to meet, I would take up on that, folks. Samuel is a wealth of knowledge and a pleasure to work with. Afroz asks, thank you for your presentation, first of all. What was the impact on ED throughput or urgent care access in the community with volume utilization where a TAP is located?
That's a good question. To, and it's kind of a hard question to answer too, because it's hard to measure in the sense, but you know what we've noticed from survey responses, a lot of these people, you know, a lot of these people don't necessarily go to the ER or the urgent care at all. They're just not going to get services. Um,
Mhm.
and so that's one way is trying to calculate, you know, what do we actually save by getting them early access
Mhm.
as opposed to no access, waiting for it to turn into an ED visit later. Um, I think what's more interesting too is just seeing how telehealth in general affects ED. So a lot of our members, if they utilize telehealth, including these booths, then they're way less likely to utilize the emergency room. And so
So
that's
you
something
could
we're,
see a reduction in readmittance rates with a TAP
yes.
if folks have access. That's
And
fantastic.
that's something we're trying to work into our ER diversion program is trying to get more sites like this available, and just get members more comfortable with telehealth so that they can get that early touch point with providers.
Absolutely. Thank you. Another question from Efraz. I hope I'm pronouncing your name correctly. Can you provide what was the volume per day, per month, with community access locations such as library versus the school? So are you having more volume at the library versus the school? Same?
Um, you know, that really depends on location, to be honest. Um, some of the sites, gosh, and that there's a lot of nuance to that just because like I was talking about before, not all sites are equal. Some of
Mhm.
them have better buy-in than others. Some are just positioned better. Um, but for the most part, I would say that school access is probably more reliable. Um, but there are busy periods. You know, we may have at some place like Hinton, we may have 8 to 12 a month, or more. It just kind of depends. But the school program is going to be, I think, a little bit more volume in general.
Fantastic. Thank you. Rosita asks, thank you for your presentation. Samuel, you're popular this afternoon. Did you have any experience to share using tablets to go home with high-risk patients for telehealth or telehealth apps for patients to support youth, especially in mental health space? Do we have fewer funding opportunities for those? I think that was three questions in one.
Yeah, so you know that's something that we're looking in. I have more experience with that as a librarian than I do working in healthcare. Um, because the libraries we worked at, they had device checkouts that were used for healthcare, and you know, I think it's extremely important. The hotspots especially get tons of usage just because a lot of people already have phones, and so um, just getting them internet access allowed them to have those meetings on their phones instead of the tablets. But um, let me see, where was that? Oh, and a telehealth app, that's something that we have access through. So we provide Teledoc for all of our members. And we're just now getting that out into the schools. And we're also trying to work on getting the age limits lower on who they can service. So I don't have a lot of data for that specifically, but I can say that that's an area that we're looking to expand in. Um, Again, just trying to get more devices out is huge. We Another thing we do is we work with uh, so people who may qualify for Medicare, Medicaid, but not necessarily Lifeline. We work with other providers to try to get them devices, which we can send to their house. It takes maybe 2 days, day or two to get it sent out. But we rely on that a lot. And when it comes to funding opportunities, I think you'll have to ask your state probably on that. Some of those plans were clear cut on what their funding is going to be used for, but I don't know that there's a lot of those digital equity initiatives were kind of cut at the federal level, but some of the states are still pushing forward through it. So I think going to your broadband office is one way to ask for it. Going to the state about RHTP is one another way, and then also talking to your health plans. That's something if providers have really clear use cases for those, I would like as a health plan love to partner on that and try to get those out into members' hands. Like that's something we would love to do.
Fantastic. Thank you. Kaylee asks, oh, she joins us from OnMed, a hybrid telehealth care solution that functions as a clinic in a box that works
Yeah.
on a capitated subscription model. We are working diligently on applying to all 50 states' rural health transformation project plans. Would you be able to provide some help on finding partners in the states which you serve?
Yeah, definitely. We have libraries that are going to be applying. So our brand broadband office set aside funding for this, specifically through CPF funding. So we'll have a bunch of libraries applying for that. I think there's going to be opportunity to reach out through those sites as well. And then again, our rural health transformation program has the same telehealth initiatives in it. So yeah, again, we'll be happy to partner on that.
Fantastic. Thank you. If there is measurable opportunity on outcomes and financial, then is there opportunity for subsidization via local health partners?
Yeah, I think that's something you could definitely do. I think it's something that we've utilized for schools, having some local provider partners that are on the other end of those visits, but it does kind of create some complications in uh I guess ownership, but then also just trying to work through where members are going to go. Can they use their own providers? Um, yeah, if they, yeah, those kinds of questions.
Absolutely. Thank you. Are there any other questions for Samuel? This has been a fantastic webinar this afternoon. Great turnout on attendance. Have you applied for the Rural Health Grant?
Uh, we have not. So pretty much none of the health plans are, as far as I know, are actually applying to receive money. Most of them are going to be working through partnerships. At least in Oklahoma, we see ourselves as, you know, experts in some of these areas, not going to be receiving the money, so kind of a neutral party in that sense. Um, I am really invested in it just because rural and telehealth are my areas, but um, we're not receiving any money, so we wouldn't be able to directly subsidize any.
Absolutely. Thank you so much. Any other final questions? We are 2 minutes over, so to be respectful of time, I would like to give you all back your afternoon. The question about when and where will the slides from today's presentation be shared? Thank you, Danielle. We will send them out to the attendance list later this week, along with Samuel's contact information. And before we let you all go, please, please, please claim your CEUs for this presentation. We're really excited to offer those to our Ohio and Indiana partners and hopefully our Michigan and Illinois partners in the future. So, all right. Thank you, everybody. Thank you, Samuel. I really appreciate your time and expertise.
Yeah, absolutely. Thank you.
All right. Bye, everyone.
Bye all.